Hello and welcome to a special interview for The Wire. A series of projections published last week by the New York Times has annoyed the government by raising an issue the government prefers not to discuss. What is the actual toll of COVID-19 in India? The government has, of course, rubbished those projections, but the subject will not disappear quite as quickly. And so today I'm going to raise this issue with someone who's been working assiduously on the subject. He's Professor of Economics at the Indian Institute of Management at Ahmedabad and the author of The Age of Pandemics, Chinmay Tumbe. Professor Tumbe, before I talk to you about the actual death toll from COVID-19 in India, let's start with the death toll from the Spanish flu in 1918. I gather that the Sanitary Commissioner of India first estimated the death toll in 1919 as 6 million. 2 years later, when the census was being done in 1921, the death toll was increased to 10 million. Almost a century later, when you were doing your seminal research, you came to the conclusion that the actual death toll is probably 20 million. And if you're right, that means something like 6% of the population of the time died. That's a huge death toll, isn't it?
Absolutely. This is one of the terrible tragedies of the world. The initial estimates, by the way, for the global toll as well was 20 million. That has now been revised upwards by a variety of researchers to 40 million plus. So that was a pandemic in which about at least 40 million people died, of which my estimates are 20 million. It's not just me, a variety of researchers now place it between 15 and 20 million. It's a really interesting episode of understanding, firstly, how deaths should be calculated in a pandemic, but also the kind of underreporting that can go on in the pandemic, right? This is a pandemic which came in two waves, just like what we're experiencing now in India. The first wave was very mild. Nobody really took note of it. It was in April, June 1918. The second wave was absolutely devastating. It really starts off in a big way in India in September, October, and November is the peak, kind of a crazy month in which I estimate that on some days, maybe as many as 200,000 Indians were dying every single day. So this is a calamity of of crazy proportions. And the idea of death counting is, of course, how do you do it? And one of the things I should start by saying that even when Norman White, the sanitary commissioner who recorded 6 million deaths, he recorded this in February. So at that time, just like we have now, we have these daily death scorecards for a variety of cities and so on. They had it back then, but there was no aggregator. So nobody could really tell you that India on, say, November 20th, 1918 was having X, Y, Z deaths. So the first number that came 6 million was in February of 1919, when Norman White wrote a preliminary report. And he had the humility to say that this is likely to be an underestimate for the simple reason that the entire system collapsed. The statistical collection mechanism as well, collapsed. But he just put it out there saying this is what our recorded statistics says. The census, 1921, they go and they find that, villages are depopulated. They use intercensal growth projections to find out how much should have the population been by, and then kind of calculated the missing value. Now, over the next 100 years, what researchers have done is used two methods, basically something called as excess mortality. That is, you look at monthly or weekly data running up to the pandemic and say you take a 5-year average and you think what should have been the deaths in a normal time period and what was the deaths which are actually recorded. Now, even that, of course, suffers from some limitations, especially in a pandemic, because deaths are sometimes simply not registered. The people recording deaths also themselves die. So all these kind of things can happen. I use the intercensal growth method, which is comparing from 1901 to 1941 and seeing how many people ought to have been there in the 1921 census. And that takes you a shortfall of actually more than 20 million. But, the estimate I've put is 20 million because there were also some effects on Earth.
Let me stop with that, because the most important thing is that, in fact, in 1918, of the 40 million deaths estimated globally, 50% happened in India. And as you say, absolutely, at the time, people even a century ago were well aware that there were a very large number of deaths that they weren't able to count. The Sanitary Commissioner, Norman White, admitted this himself. In fact, one of the most interesting things is that the well-known poet Suryakant Tripathi, better known to most people as Nirala, in his memoirs wrote in 1918 that the Ganges was swollen with bodies. You say that oral histories of the time mention bodies being thrown off cliffs. or bodies being deserted in jungles. And that's very similar to what is happening this time around as well, isn't it? A huge number of uncounted deaths, a very strong likelihood that the actual total could go up way above what we believe it to be. And then this rather distressing way of disposing of bodies, letting them float down rivers, throwing them over bridges. It's happening all over again.
Absolutely. When I was writing this book last year, I did think that many of the things that happened in 1918 would happen again. But this was one thing which I did not expect to see, the bodies on the Ganga. So when I wrote those words, recounting Nirala's words, that's definitely one thing which I did not expect to see. So when the news hit this year that, these bodies are floating, and it's not just that, there were these sand graves, variety of things which journalists have documented, especially in Uttar Pradesh, deeply troubling. And it kind of tells you very quickly that, the scale of the tragedy, it's a huge tragedy that we've seen in April and May of this year. Bodies thrown off cliffs, maybe not. But of course, the calamity in 1918 was much larger, both as in absolute terms, as well as a percentage of the population. But there's no doubt that it kind of tells you that it's a big shock.
Let's, against that background, turn to what you believe is the actual COVID death toll during the present pandemic, and particularly the second wave of that pandemic. Now, in a recent article you wrote for the Indian Express on the 26th of May, you began by focusing on Gujarat. Relying or extrapolating from data made public by the newspaper Divya Bhaskar, you believe that between the 1st of March this year and the 10th of May this year, the actual death toll from COVID is not 3,992 as the Gujarat government claims, but pretty close to 43,000. And that is an undercounting by a factor of almost 11. Can you explain very briefly, how do you come to this conclusion that it's not 3,992, but 43,000?
Yeah, the 43,000 number, by the way, is from April 1st, not March 1st, but April 1st to May 10th. So it's a 40-day period. Divya Bhaskar broke this story. It's very interesting that the Gujarat government has not disputed the numbers. But what the Divya Bhaskar newspaper did was to compare the death certificates issued for a particular period this year vis-a-vis last year. Now, last year is an unusual year because of the national lockdown where a lot of activities were halted. So it's quite possible that last year's numbers are depressed substantially. And this is what the Gujarat government immediately came out by saying this is a wrong comparison. You can't just compare this year's death certificates with last year's death certificates because last year was unusual. And that's absolutely correct. So what I've done is not use last year's numbers. I've used 2019, which was a normal year, as a reference point and projected what deaths should have been in a normal year this year in that particular period. And I look at the period April 1 to May 10, a 40-day period. And it turns out that in that case, there are 40,000 odd additional deaths and not 65,000, which is what Divya Bhaskar is claiming. But it doesn't really matter that much when you look at the underreporting factors, in the sense that Divya Bhaskar pointed out, the newspaper pointed out an underreporting factor of 16. I'm saying the Gujarat government is right to say you need a better reference period. But when you do a good reference period, when you take into account expected population growth or the growth rate in deaths, what you find is an underreporting factor of 11, which is very, very large.
Absolutely. And in fact, the important thing to note is you're talking about a 40-day period. Not, as I said, 1st March to 10th May, but 1st April to 10th May. And in just 40 days, if you look at the excess death calculation that you've done, you come to the conclusion that the actual deaths were almost 11 times more than the Gujarat government has admitted. They were as much as 43,000 deaths a day. And since we're talking about a 40-day period, we're also saying that there were virtually, on average, 1,000 deaths a day during that 40-day period. Now, in that same article for The Express, you point out that the undercounting of COVID deaths in Gujarat varies depending upon the municipal corporation. Apparently, in Ahmedabad, it's an underreporting by a factor of 4. In Vadodara, it's an underreporting by a factor of 16. And in Rajkot, it's an underreporting by an astonishing factor of 30. Why is there this divergence?
It's a good question. I think a part of it is still a puzzle, which we'll get to know only later when we have more data for this period. But I can offer certain basic ideas as to why this happens. it is quite likely that the lowest underreporting factors happen in the largest municipal corporation, which means as the settlement size is larger, for the simple reason that these cities are much older, the municipal corporations have been dealing with debt status for much longer times. But more importantly, the larger cities were also more hit during the first wave. So in a way, they had already developed protocols of recording deaths by whether it's COVID or not. How does underreporting really happen? Right. The simplest way is, of course, if you die and you have a comorbidity and you have COVID, you are supposed to be, as per the guidelines, be recording it as a COVID death, but you're passed off as a death due to the comorbidity and not COVID. Right. So this is a classic way in which deaths are going, uncounted as COVID. Now, why should it be that Rajkot should have 30 and Ahmedabad should be only 4? Well, the simple reason is, how do you know when you say a person is dead because of COVID, the person has to be tested for COVID. So in a way, a lot of this variation is just simply about testing capacity. And we know that the largest cities have a much better testing capacity per capita than others. So you're much more likely to be shown as COVID positive in the first place in the largest cities of India. As you go down to smaller places and so on, the testing capacity goes. So if you die and it's because of fever, we simply don't know, whether the person died.
Can I stop you there?
Yeah,
what you're saying is, as the pandemic moves from large cities to small 2-tier and 3-tier towns and then into rural India, the registration of deaths will become more and more imperfect, if it happens at all, which means the number of uncounted COVID deaths will also go up very sharply. And therefore,
absolutely,
the present wave is moving into rural India. The proportion of uncounted deaths will be growing very significantly.
Absolutely. There's absolutely no doubt about the fact that, the fact that simply COVID testing capacity varies from state to state, within a state, from city to villages, across districts, means that a large part of the so-called reported COVID tests we are seeing is almost simply a function of testing capacity.
In fact, in your Express article, when you move beyond talking about Gujarat, you say, and I'm quoting you, as COVID-19 sweeps through rural India, especially in states like Uttar Pradesh, Bihar, and Jharkhand, where death registration statistics are incomplete, the death toll is likely to be staggeringly higher than what is reported as COVID-19 death. Briefly, explain to the audience why uncounted deaths will be staggeringly higher in UP, Jharkhand, and Bihar compared to other states.
I think the simple reason is, as I said, two aspects. One is whether you get testing or not. So the testing capacity itself for COVID is very weak in many of these states that you mentioned. But two is that even in normal times, the death registration itself is incomplete. So we're saying at the all India level today, death registration is about close to 90%, which means 9 out of 10 deaths in India go recorded. And in Gujarat, the state which I've analyzed at depth, that number is close to 100%. And that's why the Gujarat numbers are very troubling, because for a state with registration close to 100%, if you get an underreporting factor of 11 for a 40-day period, that is a very troubling sign. So now if you start going to states where death registration, even during normal times, is 70%, 80%, which means a lot of deaths, whether it's COVID or not, is going unrecorded in usual times, right? And so how will we ever know this? We'll have to wait, unfortunately, for a fairly long time until the census comes out, because the census will tell us, how many people are left in the village in some sense. And then you can get a sense from the previous censuses to see the missing populations.
But therefore, you are now saying that there are two good reasons why the quantum of uncounted, unreported COVID deaths will grow. The first reason is that the pandemic is sweeping increasingly into rural India, where registration is anyway weak. And the second reason is that if even in a state like Gujarat, which claims to have 100% registration of deaths, you still have an underreporting by a factor of 11 over just a 40-day period, then when you come to states like UP and Bihar and Jharkhand, where in fact registration is only 70-75%, then that's the second reason why underreporting will grow. So in other words, every time the pandemic moves into states like UP, Bihar, and Jharkhand, or into rural India, the underreporting and the proportion of underreporting will get bigger and bigger and bigger.
Absolutely. And that's why we deal with bounds, like what are plausible bounds for the underreporting factor? Again, that's why the Gujarat numbers are very significant, because it covers a large state with good registration data for a 40-day period and a core 40-day period of the second wave. So at this stage, while it would be impossible to put an exact number, on the deaths in many of these states, my sense is that we will get, eventually we will get down to a much better idea, and those numbers are going to look, very different from the reported numbers.
Let me put it like this. When the Yogi Adityanath government in UP, which bear in mind is India's biggest state with a population of nearly 200 million people. So when the Yogi Adityanath government claims that since the start of the pandemic, that's 15 months, the total death toll is still under 21,000, you say to yourself, this is just an unbelievable figure, it's not true. Do you have any sense of what the actual death toll is likely to be, or is it just hard to say?
I'm not going to, put a number on it, but it's going to be very large for the simple reason when we say that, the entire pandemic in UP, which is India's most populous state, so many people have died in the second wave, when we've seen, fantastic ground level reporting of the kind of, tragedy that unfolded. This is a cruel joke. I mean, that's how it should be, really put as the reported numbers. So the numbers, as I said, the numbers will come out, whether state governments like it or not. The numbers will come out at some point, and it's not going to be this, that's for sure.
So even though you're reluctant, and very understandably so, to try and guess what the actual death toll over the entire pandemic in UP is likely to be, and that is really perhaps a mug's game because it's close to a guesstimate at this point, nonetheless, you firmly believe that the Yogi Adityanath government's claim that from the start of the pandemic, the death toll is just 20,346, which is what the official figure was yesterday, Monday, the 31st of May. That figure is definitely wrong. It's a huge undercounting.
It's a huge undercounting, absolutely.
Let me then come to the sentence I believe in your Express article will be considered by many readers as a sort of conclusion. And again, I'm going to quote you. Even the most conservative extrapolations from the available excess mortality data take the all India death toll of the second wave to over 1 million. First of all, how confident are you of that over 1 million figure?
Over 1 million in the second wave, which is still unfolding, it's not yet over. What I've written is a very specific sentence, that is the second wave, which started, say, roughly mid-February, and it's going to end, many, many weeks later. So we are still not at the end. I mean, we are still, as we speak, much higher than where we were during the first wave, right? Both in terms of reported cases and reported deaths. So the second wave is not over. So my number is not about how many people have already died. My number is about, as the second wave unfolds, how many people are likely to have died. And I would place a very high chance that over 1 million people have died in the second wave alone. Now, how do I come to this conclusion? I looked at, all the available pieces of information. So first, let's start with the Gujarat underreporting factor of 11. So we want to understand if this is an underreporting factor of 11 for a 40-day period, what are the plausible bounds for the all India number, right? So what you're trying to estimate is an underreporting factor for all India. Now, there are two ways to go about it. One is to say that some of the states in India will be much worse than Gujarat because they have lower registration, etc., etc. But that's what I'm saying is the conservative estimate. I'm going to assume, in fact, that Gujarat is an outlier. Let's assume that Gujarat, has a very high underreporting factor, and actually all the other states of India have much less. But what is the lower bound? And out here, I'm going to say that the municipal corporations of India are the lower bound. That's where you're going to see the largest municipal corporations. So we have data for Ahmedabad, Surat, which is underreporting factors of 4 to 5, 6. Calcutta's numbers have come out. Those numbers are about 6. Chennai's numbers are at 3, which means that if you look at the second wave underreporting in the places where we have the best data, the lower bound as of now for the information that we have is, or the bounds that we are seeing is between 3 to 5 or 3 to 6, right? Now, what sort of an underreporting factor do we need for the second wave toll to go past 1 million? As we speak today, the second wave has already claimed 170,000 reported deaths, right? Which means if you take the second wave, toll in entirety, that is, if you look at the next few weeks data as well, we're going to end up with a figure of close to between 200 to 300,000 reported deaths only in the second wave, right? Now you need an underreporting factor, all India underreporting factor of only 3 to 5 to take you past 1 million. And that's definitely going to happen if the municipal corporations, that is the lower bound, is at 3. And we still don't know a lot about rural India, which is more than, where close to 60 to 70% of the population lies. Much of this data is coming from urban India. So that's why these are very conservative estimates. Even with the reported data of close to 200 to 300,000 deaths that is going to play out in the second wave, you don't even need an underreporting factor of 10. You just need an underreporting factor of 3 to 5.
Very, very quickly, I will sum up what you said so the audience can actually get the bare bones into their mind and stick to it. You're saying that at the moment, the reported deaths from the second wave are already 170,000. You're estimating that by the time the second wave ends, the reported deaths will be 200 to 300,000. You're using an underreporting factor, which you say is a very conservative one of 3 to 5. Others could perhaps review something around 7, 8, or 9, or even 10. And if you therefore use an underreporting factor of 3 to 5 for a total of 200,000 to 300,000 deaths, that takes you to 1 million deaths in the second wave. Now, let me ask you another question. How many deaths did we have during the first wave?
It's a good question. The way to look at this is to understand what's different about the first wave and the second wave. The first wave was much more, the reported cases in the first wave were much more concentrated in urban India and within urban India in the leading metros. Right? That's what we know about the reported cases. There's a good chance that the first wave did not enter rural India in the same way that we're seeing in the second wave. Right? Of course, there are different strains, as we now know, of the virus and so on. So the first point to note is that the second wave underreporting factor is going to be much larger than the first wave. I think that's a given, right? For the simple reason, because the second wave has much more rural kind of penetration where we simply don't know enough from the reported cases. So the second wave underreporting factors are going to be much more than the first. How much? We do have some numbers again from the municipal corporations. The numbers for Mumbai, which has probably got the best death registration system in India, for the first wave, the excess deaths in 2020 is in the range. The underreporting factors are in the range of 1.6 to 2. We have the numbers for Faridabad. Those numbers are again from the range of, I think, 1.8 to 4, right? And of course, there are many parts of India in 2020 which also actually registered fewer deaths than 2019, for example, Kerala and so on. And that's because 2020 also had not only COVID, but it also had a very stringent national lockdown and which lasted for many months. As a result of which, a lot of deaths which would have happened due to accidents and so on actually did not happen. So you have this confounding factor.
Let's stop with that. All of that I understand, and you're giving it very usefully as the background, but it is the background to the question I asked. What do you believe is the overall death toll in the first wave?
Yeah, so the first wave's reported death toll is 150,000, right? So if you want to break up the first wave and second wave, as of now, we are at 150,000 reported deaths for the first wave, 170,000 reported deaths for the second wave, and the second wave is still not over. Now, out of this 150,000, what is the underreporting factor you should apply? I would be very conservative for the first wave and say, definitely more than 1. And it would be, I would say it's going to be very unlikely that it would exceed 3 at the all India level, right? Which means if you take a value of 3, that would mean 450,000 deaths. If you took a value of 2, that would mean 300,000 deaths. Right? But what I'm saying is the first wave and second wave are completely different. So you can't, you can't take all the oaths and apply uniform underreporting.
You explained they're very different, but the important thing is you believe that on the basis of 150,000 reported deaths in the first wave, using an underreporting factor of 2, that takes the deaths to 300,000. If you use an underreporting factor of 3, it takes the deaths to 450,000. If you then combine the two waves, you believe that you will have 1 million deaths in the second wave, and that is a very conservative estimate. Your upper end for the deaths in this first wave are 450,000, the lower end is 300,000. So taking the two together, you believe we will end up with somewhere between 1,300,000 deaths and 1,450,000 deaths.
Absolutely. When you just simply add it up. Yeah.
Let's then at that point come to the projections published by the New York Times, which have so annoyed the government of India. Now, to be honest, the government is not upset by the paper's estimation of infections, because those are actually based upon our own serosurveillance that we've done. Where the government is upset is by the estimate the newspaper has taken of the infection fatality rate. And this, depending upon the projection, jumps from 0.15% to 0.3% to 0.6%. And Mr. Paul publicly said, Dr. Paul, that there is no basis for these fatality rates. And on that count, he has dismissed these projections by the New York Times altogether. My question is simple. Do you agree with Dr. V.K. Paul, or do you think there is much more credibility to the New York Times projections? Which of the two?
I think what the New York Times is doing is basically a scenario analysis, right? So that they have a conservative estimate of something like 600,000 deaths, which is very conservative in my view. And they have an upper limit of 4 million, which it's very unlikely that that number is going to be reached. So this is, again, it's a very wide range that they've given. Now I can understand the government's response, but the government has really not come out with anything about what it believes the underreporting factor to be, right? And so you can dismiss the 4 million estimate as saying, this is something very, very out of the park. But it seems like the government's response has been one of a very, very small underreporting factor, which is not the case that I believe. So, I mean, the New York Times mid estimate is 1.6 million for the entire pandemic, right? Which is very close to the numbers which we are talking about earlier. So these are not completely out of the park. I would say the 4 million obviously is the kind of worst case scenario. Is it possible that 4 million Indians died? I think very unlikely. But again, there's a huge part that we simply don't know, and that's rural India. And rural India is, about 60 to 70% of India's population. Absolutely. So how will we get to know that? We will get to know that only a few years down the line. And as I said, because I've worked on 1918, I know from a long point of view about how these estimates can change very drastically over time. Right. And so with more information, we'll get, better estimates.
Absolutely. Just as you upped the figure for the 1918 death toll a century later to 20 million, and the global figure has gone to 40 million, it's possible, not a century later, but maybe 5-10 years later, when we have a better sense after the next census of excess deaths, that we will perhaps say even the extreme projection done by the New York Times wasn't as outlandish as it seemed today. But the interesting second point is that the lowest estimate by the New York Times is just of 600,000 deaths, and even you believe deaths are way above 600,000. And the mid-range given by the New York Times is roughly 1.6 million, and that's very close to your upper limit of 1.45 million. So if you exclude the very extreme projection done by the New York Times and you look at their middle projections, those are not unrealistic. And bear in mind that the lowest projection of the New York Times is far too small to be credible. The government never said that the lowest projection is too small to be credible. They simply commented about the upper one, which they found unacceptable. We're coming to the end of this interview, Professor Tumbe. Finally, in your Indian Express article, you ended by calling for real-time release of death registration statistics because you said, if this is available, we could identify the places currently invisible on COVID-19 dashboards, which need immediate attention and resources to save lives. Can you briefly explain this further?
Yeah, I mean, it boils down to how are we monitoring this pandemic? We have certain metrics at our disposal. We have COVID cases. We have test positivity ratios, which is an important metric. We have reported COVID deaths. These are the kind of 2 or 3 key metrics that we have. We have the Google mobility data to tell us how we are moving at the district level. So I would say about 4 or 5 points of high frequency daily data, because as we can see in the second wave, things can change in the matter of a few days. So you need to have metrics which look at India at the district or village level at a kind of daily basis. And the one metric which we do have is simply the number of death certificates issued at all these offices across the 700 plus districts of India. If only we have, a decision that says all this data has to be a live upload with no penalty to the officers. There has to be an incentive for truth reporting, right? Of course, this data can also be fudged if there's a deliberate kind of bill. But if this data was to come online, just as we are aggregating COVID deaths, what if we just aggregated all deaths on a real-time basis? We have the software available for this. As I said, 9 out of 10 deaths in India are recorded today. One can then basically just estimate excess mortality and know exactly which are the really badly hit districts of India. For the simple reason, the reported cases, as I pointed out in Gujarat, has very little basis with the actual excess deaths.
Absolutely. So what you're saying is if death registration statistics, the certificates that are issued by municipal corporations when people die, are available immediately online, we would be able fairly quickly to calculate excess death and also fairly quickly to point out to governments that the official figure is far too low, not just because evidence from crematoria, from graveyards or obituaries is making it clear that more people have died than the government claims, but also now because an excess death comparison is clearly showing that in fact you have many more deaths than you did last year or the year before or the average for the last 5 years. And the interesting thing is you say this could be made available by governments, and your words are only with a flick of the pen. In other words, it's the easiest thing for governments to do. Why do you think they're reluctant to do it? In fact, forgive me, not reluctant, they're simply refusing to do it. Why?
I think firstly, this belongs to the realm of the state governments. And I think state governments are now reaching a point where, for example, it boils down to, how are people going to react to the headline number that's given, right? And so suppose, for example, right now, Maharashtra is reporting a very high number. It receives flag for saying, why is Maharashtra not dealing with COVID well? The point is, of course, that with the underreporting factors, which are going to vary substantially across states, we simply should not be comparing reported COVID deaths per capita on a state level basis right now, because we simply don't know, what are the true estimates. The incentive problem here is that politicians or bureaucrats don't want to look bad. And I end the article with a quote from the Arthashastra, which says that public health surveillance, some ancient wisdom saying that you should not be penalizing the officer. In fact, you should be incentivizing officers to be reporting the truth. For the simple reason, I think the way to look at this is excess death registration system data is very important, not just to tell, the government is not doing a good job. It's to, in fact, tell the government where to take action, because that's the surest piece of data which will, tell you where you should be diverting your resources.
Absolutely. As you say, if the government publishes the data it has, and it only requires the flick of a pen to do so, then the government will be much better able to identify areas where the problem is growing before it becomes a crisis, tackle it, and hopefully contain it. In other words, open your eyes, you're saying to the government, when you see better, you'll also tackle the problem better. But if you insist on covering your eyes and pretending you're blind, you're endangering all of us. Professor
Absolutely.
Tumbe, thank you very much for this interview. Take care. Stay safe.
Thank you.